Hi, welcome to Chapter 3, Safety Practices. Something tells me I want to talk in a Southern accent when I do this, so if I slip into that, please forgive me. This is very important information, though. I think you'll find that we visit this a lot. First, I'm going to talk about the infection process. How does infection even get transmitted? Well, you've got to have a microbe or a disease agent. You've got to have some place for that to dwell. You have to have a way for it to escape wherever it's dwelling. You have to have a way to get it there. It doesn't get wings and fly. And then you have to have an entry point into the host or the person that's being contaminated. And that host has to be able to take on the infection. Maybe they have a weakened immune system or something that makes them susceptible or vulnerable. So there's lots of different methods of transmission. You can have direct contact, you can have indirect contact, you can touch something contaminated, there can be air droplets, you can have something in the food or water that's contaminated or a piece of equipment that's contaminated. Mosquitoes, flies, rats, or other vermin, those are called vectors, can transmit infection. And here is the chain of infection. This is so important. We have, first of all, the agent. Let's use strep throat for an example. So you have strep as the agent. The reservoir to the right is where it's housed. It has to have a way to get out. So when you cough, maybe you cough the strep out, and then that's transmitted on droplets. And then someone opens their mouth, or it gets in their nose or their eyes and settles in their throat. And because they're tired or down and out from something else, they may get the strep. So that's what constitutes the chain of infection. So when you have an infection, you can have symptoms, or you can be asymptomatic, a prefix meaning without, asymptomatic. You can have a localized infection that's just limited to a small part of your body, like a thumb, or you can have it in your bloodstream and have it go throughout your system, like a scarlet fever, which happens as a result of untreated strep throat, by the way. So general signs and symptoms of infection are fever and chills, pain, achy or tender areas, just tired because it's an attack on your immune system, maybe night sweats. If you have a local infection, you might have redness, heat, swelling, pain. There might be pus coming out of it, that would, like if you had an infected thumb or something like that. And you're going to see patients in the hospital that have those kind of things like pus, or they're coughing something that's contagious, or there's a wound that is not taken care of, hadn't been taken care of, or it just gets worse and they get put into isolation. You're not to go in isolation rooms in the hospital unless myself or Ellen are with you. Even if a nurse or someone drags you in there and says, come on, let's go in, I need you to stay out, because there's so many different kinds of infections and so many different types of isolation. It's really impossible for me to anticipate all the different things you might encounter. And also not every staff person follows the protocol that they should. So I just don't want to put you in harm's way in that process. So again, when you're on rotation, do not go in isolation rooms unless I am there or Ellen is there. All right. So some infection control procedures, just this is from your book, but I think it's really interesting. It goes back to the 150 years ago, where there started to be separate facilities for infectious patients, and they started quarantining off different patients with different things and using barrier methods. In the 50s and 60s, tuberculosis was very prevalent, and those places were actually someplace people would get sent away to sanatoriums and whatever. But by the 70s, most of those places had been closed, and they realized tuberculosis patients didn't need to be isolated. I think the big key thing here is in 1985, universal precautions, or now what we call standard precautions, were implemented, and that was right in the beginning of the HIV and AIDS crisis that happened in the mid-'80s, where they started to realize that all bodily fluids should be treated as if it was infectious. So the onset of standard procedures, standard precautions, or universal precautions, you'll hear all different ways of saying that, means to you that all body fluids are considered infectious, and you have to protect yourself against that using personal protective equipment, gloves, gowns, masks, shoe covers, whatever, so that it doesn't get on you or splash in your eyes or in your nose or in your mouth. And so it's important that you follow those procedures and whenever there's any handling of body fluids or the possibility of touching any body fluids. Here's just some ways different diseases are transmitted. Measles and TB and chickenpox are airborne. Droplets kind of methods where you actually have to inhale something that's kind of wet from somebody else. Diphtheria, pneumonia, pertussis, strep, pharyngitis, scarlet fever, adenovirus, influenza, mumps. And then direct contact, maybe somebody has a gastrointestinal infection, they don't wash their hands after they use the bathroom, they handle some fruit at the supermarket, you go home and eat that fruit, that kind of thing. And all these other direct contact methods, like MRSA is one of them, where wrestlers, for example, are using the mats at school, they sweat, there's germs in the sweat, the germs fulminate, they grow, nobody wipes down the mats, and the next thing you know, the whole wrestling team has MRSA, which is a very hard to treat infection because it's become drug resistant. Standard precautions, you're going to always do hand washing. Hand hygiene is the number one defense against infection that you could possibly have. So when that comes up over and over again, always remember hand washing, number one precaution you can take to transmit infection and also to prevent yourself from becoming infected. You always wash your hands before and after patient contact, after all contact with bodily fluids or moist surfaces, whenever you take off gloves or wherever there's anything visibly soiled. But in the hospital, clinical areas, you're going to be washing your hands constantly. Personal protective equipment, gloves, gowns, eye protection, which I gave you all goggles. Make sure you have your goggles every day of rotation. A head cover and footwear sometimes are necessary. There's different ways we dispose of sharp objects in the hospital, and those sharp objects ultimately get burned. They're considered hazardous waste, and they're incinerated in a special facility that goes around to all the different doctors' offices and hospitals and collects it, and then they pay to have it taken away. There's special ways to handle laundry, soiled bandages, and that kind of thing. We do require that people get their hepatitis B vaccines if you're going to be in healthcare, because that is a bloodborne infection, and you have to follow the protocols. So we don't want anyone to have to spend the next 6 months to a year on prophylactic medication for AIDS just because they didn't follow these steps. Personal protective equipment, again, gloves, gowns, aprons, masks, eyewear. Sometimes you'll see signs outside patients' rooms that tell you exactly what you need to wear in the line of PPE or personal protective equipment. We're going to do gloving today. There's sterile gloving and non-sterile gloving, and I will show you more about that when you get done. But we're going to practice putting on gloves and taking them off so that you don't contaminate yourself or any of the surfaces around you. I just talked about MRSA, but really the best way to prevent MRSA is to keep the surfaces that might be contaminated with infection clean, and also keep any open lesions covered so that there's a barrier between the infection and an open lesion. And if you go to the gym, people have gotten MRSA on their forearms from putting their arms down on those weights that you lift and on the benches and that kind of thing. So you should always shower after you go to a public gym in particular, because they are a hotbed of infection. So here's some other diseases that also are difficult to treat with antibiotics now because super strains of these now exist. Gonorrhea, head lice, malaria, MRSA again, the Streptococcus pneumoniae, which causes pneumonia, tuberculosis, typhoid fever, vancomycin, glycopeptide intermediate, Staphylococcus aureus, which is a great big long disease, and VRE as well, vancomycin resistant enterococci. So those are some of the diseases that have become very difficult to treat because people have overused antibiotics. It's killed off the weakest versions of the virus and the strongest have survived. So this is what happens when there's an over-treatment with antibiotics and people don't finish the prescription. You have a sore throat, they think it might be strep, they give you an antibiotic, and 2 days later you feel better and you stop taking it. Well, you've killed off the weak bacteria. That was easy enough, but the strong bacteria survive and replicate, and then it becomes a super strain of bacteria. So always finish your prescriptions to the bitter end. Hand washing, we're also going to go through that again, but you have to always wash your hands before you start work, between each client, before and after you eat, before and after using the restroom. You don't want to contaminate any part of you with anything, and there's nothing germier than the surfaces of the hospital, and before you leave work. Again, if you're going to have any contact with blood, body fluids, mucous membranes, or wet secretions, you should always wear gloves. These are just little demonstrations that you want to make sure your hands are lower than your arms so the dirty water doesn't drip up your elbows. You want to scrub. You want to do that for at least 45 seconds. And people sing the ABC song while they do that. And you want to rub your nails against your palms and scrub in between your fingers and the backs of your hands as well, because all of that can harbor infection. And then you want to rinse, keeping your hands pointed downward, but never touching the inside of a sink. Again, there's nothing germier than the inside of a sink, except maybe the floor of a hospital. And you want to get all the soap off so that it doesn't cause irritation, because it's very drying to wash your hands that much. Some principles of asepsis, really, it's just keeping surfaces clean with disinfectants and antiseptics. We don't have sterile surfaces in the hospital unless something has been sterilized through a technique that involves high heat and steam or chemical sterilization. We'll talk more about that in a bit. We want to always practice good body mechanics, lifting with your knees, not bending over at your waist to pick things up, maintaining good balance and good posture, and using whatever kind of equipment might be helpful, like transfer boards when you're getting patients in and out of bed, and lifting belts and that kind of thing to prevent back injuries. A back injury is a lifetime affliction, and nobody wants to endure the pain that goes along with that. Fires are very common in hospitals, and it's very important, since patients can't get up and run out, that you are very aware of what to do. Fires need oxygen to burn, and so we have to kind of try to cut that off with fire extinguishers and closing off doors and that kind of thing. There's race and pass. Race is rescue the patients first, then sound the alarm, then go back and try to contain the fire if possible, and if you have a fire extinguisher or a hose, put it out. If you do have a fire extinguisher, you must remember pass. Pull, aim, squeeze, and sweep. You pull the pin out, you aim the foam or the mist at the base of the fire, squeeze the handle, and sweep the flames in order to get it out. So race and pass. So in summary, standard precautions include the procedures used to prevent the spread of microorganisms, but your primary method of disease transmission is always good hand washing. There's 3 levels of medical asepsis. There's antiseptic, disinfectant, and be completely sterile, which is void of any kind of germ or bacteria at all. So an antiseptic could be used like antimicrobial hand gel to get rid of any or limit the number of infectious germs on the hand, disinfectant for surfaces like a Clorox wipe, and then sterile, which is completely germ-free and requires special treatments with high heat or chemicals. There's an organization called OSHA, you remember that from your reading, that keeps the workplace safe. Remember our chain of infection. You got to have an agent, a reservoir, a way for the bacteria to escape, a mode of transmission, an entry path for that transmission, and you've got to be susceptible. So you want to keep your immunities up as best you can. Always maintaining good body mechanics when you're working with lifting patients or dealing with heavy equipment. Bending your knees, keeping your feet about shoulder width apart in a broad stance, and keeping your back straight. That is the last I have of the slides, but I just want to reiterate, we will be gloving, we will be practicing hand washing today, and you must always remember hand washing is the #1 prevention of disease transmission, and it's not just to keep the patients healthy, it's very important to keep yourself healthy too.